Right now, Democratic congressmen in Washington are scrambling to prevent a subsidized health insurance program from being defunded for low-income children. Although cuts are not expected for Medicaid, CBS 4's Santiago Caicedo tells us that those who have CHIP might have to find a new way to pay for their kids' health needs.
By the end of February, 400,000 children in the state of Texas could be without government-subsidized health insurance through the Children's Health Insurance Program, also known as CHIP.
You have counties along the Texas-Mexico border where 3/4 of the children are enrolled in either Medicaid or CHIP.
CHIP is different from Medicaid, in which families make too much to qualify for Medicaid, but still don't make enough money to afford paying for private health insurance through an employer for their kids. In the meantime, Centers for Medicare and Medicaid Services is giving the state $135 million to continue the program through February. After that, CHIP will no longer receive funding from the federal government.
The alternative is, do we pay bills, our gas, our light, or do we buy, medication?
Since the cost of living is low in the Rio Grande Valley, many families make a lower income and many qualify for either Medicaid or CHIP.
One of the things that's different about the valley is that, as everyone knows, the cost of living is much lower there than it is in some of the big cities.
In the Rio Grande Valley, there are a total of 23,980 children who are under CHIP in Cameron, Hidalgo, Starr, and Willacy counties, according to the Center for Public Policy Priorities. Valley congressmen in Washington are trying to keep CHIP funding for Texas. However, Representative Filemon Vela says Republicans want to condition those cuts to Medicare.
What the Republicans are trying to do with CHIP and community health centers is very much like what they're doing with the Republican health plan, is take from one program to give to another, and they're just moving the ball around.
Representative Vela says that Democrats are waiting for a Senate version that will give authorization for CHIP without conditions that slash Medicare for senior citizens. Some Valley residents agree that CHIP should be cut to an extent.
Keep it to a level that if it's really needed.
Reporting in McAllen with complete Valley coverage, Santiago Caicedo, CBS 4 Valley at 6.
Now, federal funding for CHIP expires by the end of February in the state of Texas.